What is internalized stigma for drive TB patients? Imagine feeling like you are carrying a heavy emotional burden just because of an illness you cannot control. That's what internalized stigma for patients with drug-resistant tuberculosis is all about. When someone has drive TB, they might start to believe the negative stereotypes and feelings society associates with the disease. Even if they are no longer contagious, they might feel ashamed, guilty, or unworthy. This internal acceptance of society's negative views can lead to deep emotional struggles like depression, anxiety, and low self-esteem. In many communities, tuberculosis, especially its drug-resistant form, is misunderstood. People often think it's a sign of moral failure or poor hygiene, which isn't true. These misconceptions can make patients feel like they are morally at fault or dangerous to others. As a result, they might start to see themselves as contagious or undesirable, even when their medical condition no longer warrants such fears. This can cause them to withdraw from friends, family, and social activities to avoid judgment or rejection. Sometimes, patients hide their illness using less stigmatized words to protect themselves from social rejection, but this can also delay seeking help or support. Internalized stigma doesn't just affect feelings. It influences behavior too. Patients may avoid going to clinics or taking their medication regularly because they fear being judged or discriminated against. This can lead to poor treatment adherence, which worsens their health and increases the chance of the disease becoming even more resistant. The emotional distress caused by internalized stigma can be so severe that it may lead to thoughts of self-harm or suicide in some cases. Cultural beliefs and misinformation play a big role in fueling internalized stigma. In some cultures, TB is linked to moral judgments or seen as a punishment, which can intensify feelings of shame. Healthcare workers and family members sometimes unintentionally reinforce these beliefs by giving inconsistent or fear-based advice. To help patients, health programs need to include mental health support and community education that challenges myths and promotes understanding. Addressing internalized stigma is crucial for improving treatment outcomes and the well-being of drive TB patients. Providing psychosocial support, fostering supportive environments, and educating communities about the facts of TB can help reduce this internal burden. When patients feel accepted and understood, they are more likely to stick to their treatment and regain their confidence. Remember, every person's experience is unique, and medical professionals can offer personalized care to help them through these challenges. If you or someone you know is dealing with drive TB and internalized stigma, reaching out to healthcare providers for support is an important step toward healing both physically and emotionally.